Torticollis is a common newborn condition that can affect how well a baby will bottle feed or breastfeed. Today we'll be talking about everything you need to know about torticollis and how to get it treated fast. So click those like and subscribe buttons and stay with us. Torticollis comes from the Latin word for twisted neck, and that's kind of what it is. Your baby has a stiff neck that's hard to turn. This is because the sternocleidomastoid muscle, which connects the back and neck to the breastbone, are contracted, and it causes your baby's head to kind of tilt. This can be congenital, which means it's present at birth, and we may note it up to about 2 months of age, or acquired, which means it shows up later and we can note it around 4 to 6 months of age. Recognizing torticollis is very important to getting it diagnosed. So the signs start with a baby whose head tilts to one side and the chin to another. You may also notice there's a very limited range of motion in the head or neck. One shoulder can sometimes be higher than the other one, and the neck muscles may seem very stiff. You may also see swollen neck muscles. Congenital torticollis oftentimes is associated with breast or bottle feeding issues. You may also see a small lump in the baby's neck or a flat spot, but it's on one side of the head. Acquired torticollis often has recurrent episodes of head tilting, head tremors, or even neck pain. Diagnosis of torticollis is usually made on physical exam by the pediatrician. This can then be confirmed when they are sent to a physical therapist for evaluation. Rarely we'll do a neck x-ray or a CT scan. But torticollis may be noticed before your pediatrician sees them. It's often found by speech therapists or lactation consultants who are helping a family teach their baby to eat. Please remember to hit the like and subscribe buttons so you can get our latest content. Causes of congenital torticollis include uterine position, which is the most common. Think about it when you wake up in the morning and your neck is stiff because you slept wrong. It's the same idea. Your baby was in an abnormal position in the belly and it caused a stiff neck. Other congenital causes include abnormal development of the sternocleidomastoid muscle, birth trauma, including birth trauma from breech, forceps, and vacuum deliveries, and damage to muscles. Rarely, we may find this caused by a short neck, short limbs, genetic diseases, or bone abnormalities. Acquired torticollis can be caused by mild viral infections, minor head and neck trauma, GERD, which is reflux, vision problems, and sometimes reaction to medications. For congenital torticollis, physical therapy with specialized stretching exercises is the #1 treatment. You'll also be encouraged to use tummy time often. Changing sleep position can help, and sometimes you may need to have surgery for your baby. Babies with congenital torticollis will oftentimes also require feeding assistance from either a speech therapist or an international board-certified lactation consultant. Acquired torticollis focuses on relieving the signs and symptoms. We may give your baby some NSAIDs, which are non-steroidal anti-inflammatory drugs for pain and inflammation. You may receive antibiotics if it's an infection, or reflux meds if your baby has gastrointestinal reflux disease. The American Academy of Pediatrics says consider lying the baby on their side for tummy time if they aren't able to tolerate regular tummy time. Also, heat, massage, Botox, neck braces rolled up behind the back, a washcloth rolled up behind the head can help with your baby's torticollis. I hope this video has helped you learn everything you need to know about torticollis and how to get it diagnosed and treated. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those into the description below. Thank you so much for joining us at the Maternity Mentor.